all to the panel discussion on learning from disruption for health system strengthening. And as we all know, the COVID pandemic has affected and crippled the healthcare system of the developing and developed countries alike. And our Indian healthcare system was very fragile to begin with and needed innovative minds and a lot of emergency fixes when the COVID pandemic hit us. And so since March 2020, I've been closely involved with the way hospitals and other healthcare providers dealt with the response to the pandemic as part of a public-private partnership led by the District Magistrate Lucknow. So during that uncertain time, I've seen at close quarters how the Indian Administrative Service has come together to help fight this pandemic with innovative features and putting in new systems and, generally getting a grip on how to handle the response to the pandemic. So our panel today has public health and state administrators who will, from their experience, and tell us how to handle such large-scale responses and propose recommendations on how we can, manage things in the future to strengthen our healthcare. And today we have 4 such officers who have shown the way in bringing together technology, administrative experience, and a deep knowledge of on-ground realities in such a way that India could firstly deal with the pandemic and then hopefully use the lessons learned to shape the Indian healthcare systems for the future. I would also like to thank Mr. Kumara Guru, the Director of External Relations at the Indian School of Business, for his help in inviting today's panelists. So in the panel, it is my privilege to introduce first Shri J.S. Ranjan, Principal Secretary to the Government of Telangana for 2 departments, Information Technology and Electronics, and Communications and Industry and Commerce. Shri Ranjan is a 1992 batch IAS officer, and he supports many social, cultural, and charitable causes, and is on the boards or advisory committee of United Way in Hyderabad, Save a Child's Heart, that's the Such Foundation, Young Lives of India, Save the Children, Sparsh Hospice, and many, many more. I've had the privilege to know and be associated with Shri J.S. Ranjan both professionally and personally over the last 15 years. Firstly, he has helped us immensely with my cleft project, which I had in Hyderabad as the District Collector and Magistrate of Khammam in the erstwhile state of Andhra Pradesh. Personally, our daughters went to school together. They were classmates. And then I used to always talk to him whenever I got the time. And then he's got a wealth of knowledge in the information technology field and the health services field. And our second panelist for the day is Shri Bhaskar Kattamneni. He's the Commissioner for Health and Family Welfare and also the Mission Director for the National Health Mission in Andhra Pradesh. And he belongs to the batch of 2004, and he's held several key posts like the Zonal Commissioner of the Greater Hyderabad Municipal Corporation, and he's also been the Joint Executive Officer of the Tirupati Devasthanam. And after that, we have the next panelist, Dr. Dareez Ahmed, is the Executive Director Guidance, Government of Tamil Nadu, which is the nodal agency for investment, promotion, and industry facilitation for the state of Tamil Nadu. He's a medical doctor turned bureaucrat who joined the IAS in 2005. Dr. Ahmed has previously served as the District Collector of Perambalur District and the Mission Director of Tamil Nadu State Rural Health Mission. Shri Ganesh Dayalan is a 2011 batch IAS officer. He is the present Deputy Commissioner, SAS Nagar, Government of Punjab. He has also served as the Additional Chief Executive Officer of the Punjab Bureau of Investment Promotion, better known as Invest Punjab, and the Chief Startup Officer, Punjab, before his present assignment. The moderator for today is Professor Vijay Sundar, who's an Assistant Professor, Operations Management at ISB. Professor Sundar has 15 years of corporate experience in the area of operational excellence prior to joining ISB. He was the head of process excellence at the World Bank Group and has previously worked with Barclays, American Express, and Citibank in different leadership capacities. With this, I will now request Professor Sundar to moderate the session.
Hey, thank you very much, Raj, for that great introduction. I hope I am audible to everybody. So I am excited today to moderate this eminent and diversified panel comprising of 4 IAS officers from different parts of the country. A warm welcome to all of you. I'm sure it will be an interesting session to learn from the panel members' experience the way various governments have responded to the disruption that COVID-19 has brought in the context of Indian healthcare systems. So while I have a few questions to ask the panel members, I also believe it will be interesting to pick up a few questions from the listeners as well. So please feel free to type in your questions in the Q&A window, and I will try to pick up a few of them and route to the panelists towards the end if the time permits. Okay, so without much delay, let's get on to the topic. Learning from disruption for health system strengthening. So to structure this presentation, I would break it into two parts. First, learning from disruption, and second, strengthening the health systems for the future. Okay, so let me start with Shri Jayesh Ranjan. So the COVID-19 crisis has been challenging to handle. So Jayesh, can you share your experience of planned crisis management in the context of healthcare systems during the COVID-19 disruptive crisis?
Thank you. Thank you, Professor Vijay Sundar, and good evening, fellow panelists. Greetings to all the listeners, all the attendees. All of you know this, that while the pandemic has been very disruptive and very severe all over the world and also in our country, but if you look at the state of Telangana, which is the state that I represent, our numbers have never been alarming. Even during the peak of this pandemic, let us say during the months of May, June, etc., we were never in the, let us say, the top 10 most infected cases, or the top 10 states where the largest number of fatalities were happening. Our numbers were extremely modest. And even now, when hopefully the pandemic is really bottoming up, our numbers are absolutely, I mean, new cases are coming in a trickle. Now, some people will be skeptical. They will say that perhaps the government is fudging the numbers and the reality is something different. But I have a different indicator to measure. I mean, I don't really represent the health department, so I can't really vouchsafe whether the government, the health department is fudging or not. But I have a different indicator, and that indicator which I use is how many phone calls I get every day asking for my help to get a bed in a hospital or some plasma therapy. And I can tell you for sure that in the last at least 4 to 5 months, I have not got even a single phone call. While during, let us say, March, April, May, there were many phone calls which I would receive. So a very good indicator, a very good proxy indicator that things are absolutely under control. But then to go back to it, to this point, that how is that happening? I mean, it's not a miracle. It's not that God is kinder to Telangana as compared to other states. There's something else which is happening. And what is happening here is a very effective use of technology. And this is something I can speak about because I'm myself involved in searching and scouting for many of those solutions, getting them validated, getting them adopted state-wise, so helping them scale up and so on and so forth. And there are so many examples to give. But let me give top, let us say, 4 or 5 very quick examples. So for instance, once we realized that testing is the key to COVID management, we encouraged a startup located in Hyderabad who came up with a very accurate and a very low cost test kit. And then in that sense, we became self-reliant. I remember in the early days, states were falling over each other to place orders in South Korea, in China, and all over the world to get test kits because there's a huge scarcity of those kits. But we were very, very quickly, in no time, able to generate a local agency to design those tests, develop those tests, and then mass produce those tests. Similarly, while we all are familiar with Arogya Setu, which is a popular and also much maligned kind of application, but in our state, without any controversy, without any kind of stoking any concerns, public concerns, we were able to develop, again, with the help of an entrepreneur, a technology entrepreneur, our own testing and tracking kind of a app, which is called T-COVID app, which also has been downloaded and utilized, and even today serves our interests quite a lot. Similarly, I remember in the early days, ventilators were a big issue. In fact, there was again a scramble, a run for all kinds of imported ventilators. In Telangana, we have a facility, a government-run facility called T-Works. It is incidentally the country's largest prototyping facility. And some enthusiasts, some startups were able to put together a prototype of a ventilator with all the functionalities without compromising on any or without diluting any functionality, and which costs 1/10 of what these imported one costs. And now it is now getting mass produced. So, I mean, there are so many examples. Lots of solutions are floating around on this quarantine monitoring and home assistance to people who are in quarantine. Our government also has a very effective app, which is called HITAM, HITAM, which has been used for the last, I would say, 4 months. And there are so many other things. There's another tool which monitors the inventory of consumables. See, in the early days, if you recall, masks and PPE kits, etc., were in short supply. So very optimum distribution and supply chain of some of these. So, I mean, I can go on. I can go on and on, but the fact is that lots of technologies have been used, and I would very clearly say that this is the most important reason why the number of cases, number of infections, number of fatalities in Telangana is very, very less. So definitely, technology has assisted states during their COVID fight. Telangana is a very good example, but I'm sure there are equally impressive examples elsewhere as well. And the long-term message this gives is that one has to embrace technology. There are all kinds of amazing products, solutions, tools, etc. First of all, you need to have a mindset to embrace those technologies. See, there are still large, I mean, the healthcare system as a system still has a status quo mentality. Whatever I used to do in the 19th century perhaps still holds true. But COVID has in some ways given them a new sense of what is possible. And hopefully, if that kind of optimism percolates later on also, we can truly transform healthcare systems into technology-driven systems. Another thing, one small point, since you mentioned about takeaways, another thing which I noticed, I mean, I must confess that it happened in Telangana as well, and I'm sure it would have happened elsewhere, which is that lots of other kind of diseases, they got sidetracked. I mean, while it is understandable that the focus of the entire healthcare machinery was on COVID management, but let us say I'm suffering from some other ailment. So those kind of patients who had to manage different kinds of ailments, they had a difficult time. So how does one ensure that you are not reliant so much on tertiary healthcare or hospitalization? There are remote diagnosis solutions, telemedicine, teleconsultation, and so on and so forth. So one needs to still work on multiple other things so as to ensure that in future also technology is able to truly serve the requirements of any level of patients, regardless of where you are, however remote you may be, however your modest your means may be. So this is, in my opinion, a very big task. But as the COVID experience has shown, we can be really up to that task, and we have in ourselves the capabilities to uncover useful and impactful products and solutions.
True. Thank you, Jayesh. I mean, that was insightful, because I agree with you that technology has a big role to play when we are talking about crisis management. And this technology point which you raised right in the beginning resonates very well with the current research that is happening at the Max Institute at ISB. And thank you very much for sharing your views on that. Now, let me move on to the next panelist, Bhaskar. Bhaskar, you have been the mission director for the National Health Mission in Andhra Pradesh. So what is your experience in planning and handling the health systems during the COVID-19 disruption?
Thank you. And I thank ISB for inviting me for this panel discussion. And I also, along with the other panelists, glad to join in this panel discussion. The first things first, when the pandemic hit us, so the first few days, everybody was clueless across the country, across the world, because our health system, I would say that is true for the entire country, was never geared up to tackle these kind of numbers. So our ICUs, our normal hospital systems were all geared up to a normal kind of a health system, but this was a pandemic. So the first thing that we did was to improve and strengthen our traditional health system, in the sense that in the third week of March, when the first batch of cases started coming up, we had our first case on the March 12th. Our health system had only 3,600 total of oxygenated beds, and the total number of ventilators that we had was less than 100. This was because the historical legacy that the combined state of Andhra Pradesh, a lot of investment in healthcare in the private sector also, and even in the government sector, has happened in the city of Hyderabad. A lot of infrastructure was created in the city of Hyderabad, but all the smaller towns and smaller areas didn't have much infrastructure in the government sector and also in the private sector. Visakhapatnam did have a little bit of infrastructure, but that was not sufficient. So we embarked on a process of improving our infrastructure in terms of ensuring the patients get the care. And we didn't do the earlier mistake of concentrating everything in one town. So we ensured that all our 13 districts rose up and improved their capacities in terms of infrastructure. And that journey, which started in the third week of March, so we came to a stage that today, I'm happy to say that we have 4,500 ventilators installed across the state in all kinds of institutions, both public as well as private institutions, and as deep as going to a smaller tier 2, tier 3 towns, and in many cases in public institutions, as small as community health centers, we have installed beds which can support oxygenation, because our journey, clearly initial days, there was a lot of talk about having ventilators, but after about a month and a half of our experience, we realized that more than ventilators, it was a constant supply of oxygen, passive oxygen, which is going to be helpful. So we increased our oxygen infrastructure, we increased our beds, in the sense that as I've indicated, we had very little oxygen beds, and from that stage today we have come to a stage that we have 37,000 beds available for treating any kind of COVID patients. Apart from, I'm not talking about the regular treatment for the regular other issues for which people come in. And we could develop this within a span of around a month and a half, 2 months. And then today we are having 243 hospitals, which are totally dedicated COVID hospitals. Though the number of cases today that we handle has come down, is quite low. Today we are handling less than 1,000 cases in the hospitals. But we are still ready with another 36,000 beds available with us for any second, third, or whatever waves that are going to come. Our system was geared up, and we took this as an opportunity. In fact, we found that there were huge gaps in terms of HR. We had a shortage of around 3,500 medical professionals. We filled each one of them, but we also took this as an opportunity for a long-term measure of putting in more doctors. So what we did was that around 10,000 new medical professionals were brought in on a full-time basis. They are there forever. They're going to be with us for the next 30 years. And these 10,000 include specialist doctors, general medical doctors, and all kinds of technicians we brought in. And that's a big leap. I would say that no state had ever recruited 10,000 medical staff at one go within a span of 40 days. And with this kind of staff, what happened is that now we are able to run all our PHCs in a 24/7 basis. Our PHCs now run on a 3-shift system with a doctor available round the clock, and all services available up to the PHC level on a 24/7 basis. Apart from this, for COVID, we had around 22,000 people were hired on a temporary basis. That means we put in 30,000 new HR into the place, spread across all the districts among these 243 hospitals. And we went beyond what would anybody consider normal, that basically I hired people for the private sector also and paid for them. We hired doctors, we hired specialists, we hired technicians even for the private hospitals which were running for COVID. And we took over the hospitals, we put our HR, we also supplied drugs, we gave technicians, and we took basic control of these hospitals, that we created so many beds that uh, even during the peak, all of us have to be remembering that we handled the second highest peak in the entire country. After Maharashtra, during the months of July and August, we had the second highest peak. But you would never see in media that people are, coming to hospital asking for a bed, being returned back, saying that there is no bed available. Of course, there will always be a bit of mismatch between demand and availability at a location.
Right.
People have special preference for a particular location, they would go there. But we could manage that with using technology. Though on a real-time basis, availability of each bed was online, because every admission, every discharge, and not only admission and discharge, but also the status of each patient was online and accessible even to the general public for which they need access. For example, everybody could see how many beds are available in each hospital, and this would be updated on a real-time basis as each patient would come in and each patient would go out. Not
Right.
only that, we made available the data of all the patients to their relatives, which hospital they are, what kind of tests have been done on them, and what are the results of this test, and what are their vitals also. We made available to the patient's relatives, and only to the patient's relatives, because the privacy safeguards have also been taken care, and it was through our website, where only the patient's relatives could access with the consent of the patient. When he is admitted, a phone number was taken, and through an OTP generated through that phone number only, the relatives could get the data also. So we took this opportunity to ensure that our healthcare system is improved, and not only at the district level, but also even at the lowest level, we could improve that. Today we have CHCs which are having uh, uh, assisted ventilation system. We have CHCs where a lot of specialist doctors have been recruited, physicians have come in. So in the next coming days, I think healthcare system would definitely benefit from what has happened during the COVID. And as been always there in the media, we were also testing very aggressively. The entire COVID, one should remember that any state for that matter, whatever testing they are doing, they're only discovering a very minute fraction of the actual positive persons. If I am doing 100 tests and I'm discovering, say, 10 positive persons, this is true for every state, every country. If you're discovering 10 positive persons, means there are another 60 persons in the population who are positive. The number of positive cases is no indication of the number of actual positive people in the society. It only gives us an indication that how do you gear up for the system. We did aggressive testing. Ours was the most aggressive testing, I would say, for the entire country. Per million, we were doing the highest testing. Even today, our per million testing is roughly about double the country's average, and many times many other states. So, and one good thing that we have done is that from day one, our entire testing database was online. There was no offline system, no manual system, no writing time, no writing sheets going to the testing center. From the time a person requests for a test till he's tested, and now based on the test, his contact tracing, the way he is isolated, where he is kept, how he is admitted, his treatment, his discharge, and in any untoward incident, any death, everything was online.
Absolutely, Bhaskar. I completely agree with you. And thank you very much for bringing the perspective from an infrastructure point of view. And from a public perspective, when we look at the entire situation, there is panic everywhere. People look for some kind of support from the governments. But when we look from your standpoint, when we see the whole picture from what you just said, it looks pretty different. I mean, it's a mammoth task to manage. Every bed matters, every doctor matters. and every nurse matters in this whole journey of creating the infrastructure. So thank you very much, Bhaskar, for your views on that. Now that we have heard from Jayesh and Bhaskar, it will be interesting for us to hear the views from Darez Ahmed. So Darez is a medical doctor turned bureaucrat. So in the past, he has also served as a mission director for the Tamil Nadu State Rural Health Mission. So Darez, can we hear your views on our current health systems and how our planning and execution have been in the COVID-19 disruption?
Thanks, Vijay, and thanks for inviting me to this discussion. And I was National Health Mission Director of Tamil Nadu for 3 years, from 16 to 19. So how much time do I have?
You can speak for about 4 minutes.
Okay. So Vijay, like what I would like to speak about is the Tamil Nadu strategy in COVID management, actually, and that is different from all the other states which I have observed. Like actually now I'm in industries department, so I like mine is basically like think tank process for the Tamil Nadu strategy. That's what my contribution is. So basically what Tamil Nadu has from the starting, what Tamil Nadu faced the problem of choosing the test. You know that everybody says test and treat strategy, and there are many strategies in COVID management. I'm not going into the details. What I'm trying to say is that there is no treatment as such. There is only management for COVID, as you know. So testing has been a critical bottleneck, which we always try to take care of. And for that, there are different types of testings available. And Tamil Nadu has taken a decision that we will only do RT-PCR, real-time polymerase chain reaction testing, which is so sensitive and specific, one of the most sensitive and specific tests, and which can identify even a single strand of mRNA, which is available. So, and TN has taken a conscious decision not to go to the rapid antigen testing. Now, why in a management strategy that's critical for our health system is that we found that like RAT has a problem of false negatives. And because RAT is obviously, you understand, it's an easier process. It's a rapid antigen test. By default, it's a rapid antigen test. It has many advantages of not needing a very complicated process of a PCR machine. And it was like basically more simpler than what a PCR testing. But again, like, while you can see that if you see all over, RAT will be less than 30% in most of the states. RT-PCR, and mostly more than 50% will be RAT testing. So TN, what we found was that false positives were unacceptably high, false negatives for that matter, and symptomatic negatives we could not really trace back into the system. So what we took a consideration, 100% will be RT-PCR testing. So you understand that when you do RT-PCR testing, the throughput is very critical. Throughput is the number of hours which is required to do the testing. So TN is the only state in the country which I can say that RT-PCR is the mainstay of the testing, which is almost 100%. And the second thing is that, like, when you fix up this RT-PCR testing, then we need to make the results. We are able to, the fundamental shift in health system strategy is the diagnostics, the change in the diagnostic system in the state, which I found that RT-PCR used to be 24 hours. We use RT-PCR for other things, TB, like all the other things. But for swine flu also we use PCR machines. So when we tried to do this, we could get a throughput of 3 hours and cost which is less than our RAT testing. The cost which was RT-PCR, we were able to get at the cost price is less than RAT, and a timing which is almost similar to RAT testing, rapid antigen testing. And the third thing was, in Tamil Nadu, almost we have 1 lakh testing per lakh test. We are the highest, one of the highest number of tests in the country. And in that, 85% is government testing, that is free testing. So the TN doesn't depend on private sector for their testing infrastructure. So I am just talking from the TN strategy for the COVID management. Like, it was RT-PCR because we didn't want false negatives, like in the sense the symptomatic false negatives. Obviously, as sir said, that symptomatic people only will be coming to testing. Asymptomatics will still be, but the viral load and the ability to spread may not be that much. A person which is symptomatic, which has high viral load, may be able to get an rapid antigen testing, but the viral load antigen threshold may be different. So that's why TN has taken a decision of, I think it's 4 minutes is over, rapid antigen testing and 85% in government system. And because we didn't want private sector to be a big player, now it's 90% in government system. So if you want data, I can share here. I have all the data for our testing strategy. And cost-wise, it's lesser than RAT, and if it is sensitive, the most sensitive and specific test for COVID. This has been the cornerstone of TN strategy in managing COVID. And that has been a significant break in the diagnostic aspect of the whole system. That's what I would like to say.
Thanks, Darius. I mean, that is very insightful. I mean, you brought this point of being at a low cost and accuracy. That's the most important aspect, because I know how much it could create a confusion when if the diagnosis is not very accurate, and then comes our infrastructure to
Vijay, more than because every false negative test report is a passport. The person who is a false negative can just be a super spreader.
Absolutely.
Yes, because we have to go back and test him. Actually, what the guidelines is, like, we have to catch him again and test him for PCR because he's symptomatic negative. The problem, we're not able to, even I have seen what the data is, that only 10% we are able to trace back and get a PCR test done. That is what we said, okay, 100% PCR. We had to, that is a strategic shift and systematic change, which I found in the whole exercise in the system. Now the diagnostics system has been robust, because we do testing in almost every district headquarters hospital.
I mean, this is very interesting, and this gives us a perspective about how technology plays a role, how infrastructure plays a role, and also looking at the importance of the diagnosis itself. I mean, the cost aspect, the accuracy aspect, and how can we strategize all these elements in our planning process. I mean, that is great. I mean, hearing these views to pick up the learnings from how we planned and executed the current COVID disruption, I think this was great. Now, this brings to the second aspect of our discussion, which is how can we use this situation and how are we using this situation to strengthen the Indian healthcare systems for the future? So let me put this forward to both Jayesh and Darius. I wish we should not face any other crisis situation like COVID-19 in the future. But if we were to face another crisis in the future, what are your views towards strengthening the current Indian healthcare systems from the learnings of the current pandemic? Jayesh, do you want to go first?
Sure. So some of the points were already alluded by me when I made my opening remarks. So one is that technology seems to have many of the solutions which we were so far not very successful in managing well in the past so many decades or past so many years. So let us encourage more and more health tech companies, more and more solution providers to come out and offer whatever best they have. And of course, the state must also develop protocols on how to validate these solutions, how to find the best fit, how to ensure that there is a very transparent price discovery mechanism, and so on and so forth. So government's own methodologies and protocols of adopting these solutions, etc., they have to be perfected. We are still kind of doing it through a trial and error method. The second most important is that technology enabled solutions are there, but how do you create the receiving mechanism at the grassroots level? While people in the cities, people who are of means, who can afford, wearables and all kinds of gadgets, they will benefit from technology. But how do you ensure that the last person, who is in many ways the most vulnerable person also to healthcare disasters, how is he taken care of? So one is, of course, that in the remote areas, in the rural areas, there has to be a very strong digital infrastructure so that healthcare solutions go down. So in Telangana, we are now embarking upon a very, very ambitious program. I'm also the IT secretary of the state. So we are ensuring that every home in our state gets a reliable optic fiber broadband cable. And this is a very humongous task. There are 8.5 million homes in the state, and we are ensuring that each one of it, regardless of where they are, they get this connectivity. The second important thing is that even if there is a home-based connectivity, it is not realistic to expect that every household in our state or in the country will rush to the market and start investing in devices. They will buy laptops or smartphones. There'll be hundreds and thousands of households who will not really care about these things, who will not sometimes even be able to afford some of these gadgets, etc. But how do you still ensure that benefits of technology reaches them? So the model that we are planning out in Telangana is an assisted model, in the sense that there are kiosks in the villages. At every panchayat, we want to set up a digital kiosk, which is called a digital Telangana kiosk, And these kiosks will be run by an entrepreneur who is from the same village. In most of the cases, we are picking up women entrepreneurs from the same village. And of course, ensuring that the services, the healthcare services, which are digitally available today, I mean, the common people who do not have personal devices, they're able to access them as well. We all know that at the national level, I'm sure all of us know this, that on the 15th of August, the Prime Minister made a very monumental announcement about having a national digital health mission, a digital health card for every citizen, like the Aadhaar, creating a health stack, and then ensuring that all the services which are available today in a manual way are all automated, and that card becomes, just as Aadhaar is not only your identifier, but the Aadhaar is also a gateway for you to access different kind of services. The health card tomorrow becomes a similarly enabling tool. So this again is a very, as I said, a very momentous decision. And I know that countries like Estonia, etc., where they have this system, there has been multiple benefits. One is that healthcare is very easily accessible. Secondly, the cost of healthcare has come down, and I'm sure India will reap the same benefits. And in Telangana, we want to have the readiness, the full readiness to benefit from these kind of initiatives, some of these very transformative and path-breaking initiatives, much before it happens elsewhere. So these are some of the key takeaways on what we have seen in the pandemic and what should be our course correction as days and years go by.
Great. Thank you, Jayesh. Before I pass on to Daresh, can I ask you a follow-up question? I mean, you spoke about the importance of technology, especially reaching the rural India through the optic technology, optic cables, right? Now, the question is, the technology is great. I mean, the governments are reaching to the places where we need people to get access to the network, where people need to get connected in order to avail all the benefits that could be available to them. Now, the question is, how about the awareness in the people? So while the technology is there, how many of these people from the rural India are really aware how to use that? Can you share your views about that?
Yeah, so very, very valid point, and something which I personally believe in quite a lot, that unless you create a buy-in of the community, particularly the people whom we typically call the bottom of the pyramid community, unless you get their buy-in, whatever you try to deliver from the top will just be wasted. I mean, nothing really will come out of it. So I'm of the firm believer that people's buy-in can come when you can show to them before their eyes that technology can make a difference for them. So if you find out what is the most pressing challenge or most pressing problems that they face, and if you show to them that here is a technology which can solve this problem for you, then you will get their immediate buy-in. You will get their automatic buy-in. And we have tried it out. We have developed, while the roll-in of this optic fiber cable program is going on, we have demonstrated the benefits of technology or the value of technology in certain pockets, which we call technology demonstration villages. And lots of these very elegant healthcare solutions that we have introduced there, which helps people. So I'll just give an example. I don't want to eat away other panelists' time, but I'll take a minute and give you a very quick example. See, anemia is a very pressing problem in the rural area. And typically, it is the poor women in the poor households who suffer quite a lot. Now, typically, unlike a city, we don't have so many pathology facilities in the villages. You don't have labs, etc., where blood tests can be done. So we have come across a startup. Actually, the startup incubated in a government facility called T-Hub. They have created a solution which measures very, very accurately, more than 97% accuracy now, the levels of anemia in a woman by looking at the, just below your mouth, how pink that area is. So redness or pinkishness of that area. So you just need to put something in your mouth, take it out after a minute, and the reading will tell whether you have anemia or not. Imagine what kind of implication this device has as compared to a needle-based, blood collection-based procedure, which typically will never reach out to the rural people. How easy it has now become to tell whether someone has anemia and then do the right kind of intervention. So if you are able to give solutions to people which matter to them, which creates a difference in their lives right before their eyes, then this buy-in that you talk about, that will come for sure.
Absolutely. Thanks, JS. And thank you very much for that example. It is very helpful for us to kind of marry both the technology and the buy-in, the change management part of showing the success and getting the buy-in from the bottom of the pyramid. Thank you very much for that. Now, can I request Darius, what are your views about preparing ourselves for the future on the health systems? Yeah, I think Darius, you're on mute. Yeah.
Okay. So I think the most important aspect of health system strengthening, like if you have gone through the WHO's health system framework, the most important aspect, there are different 4 or 5 headings which WHO feels that health system. The first thing is that leadership and governance. That's the first thing. Second thing is healthcare financing. Third is health HR, healthcare workforce. Then drugs, diagnostic and medical technologies, and service delivery. These are the 5 pillars of health system. So when you talk about future shocks, like I will tell you, these 5 things are critical, but one thing stands out. If you ask me, what is the one thing, if you ask me to tell one thing, what you need for health system strengthening is, I will tell you that magic bullet, which I feel after working 3 years as MD and HM, is public health care. The real solution, because for example, engineers build roads, okay, doctors, surgeons do surgery, but public health here, it's actually falls between stools. Like it's a very, very specialized technical thing. If you want to do a larval survey, it is not easy. If you have to go at dengue and see that which is the type of dengue phenotype which you are going to affect, you have to catch the mosquito and do the larval survey. So the point here is that you are looking at a very, very specialist field, and you are asking, like for example, surgery, you will not ask a medical doctor to do surgery. A surgeon will do a surgery. So my point will be public health care is the one point thing which, again, I'm not trying to say that Tamil Nadu always had a public health care. Without a public health care, we cannot survive future shocks. And that care is very, very critical. Like that starts from vaccination, like in the sense that there are different levels of prevention in medical science. That is primordial prevention. Like I'll like to give an example. For example, primordial prevention, even before that obesity happens, you try to prevent that development. Primary prevention, you do a screening and try to find out, do you have hypertension or not? Secondary prevention, you take a tablet and try to prevent the hypertension from affecting you. Tertiary prevention is that already you have a problem, you do the retinopathy, like you have diabetic retinopathy or a dialysis, you do a dialysis. So when you look at the different levels of prevention, I'm just giving you an example. The best way is primary and primordial, and that can be only done by public health care. Even when you have unexpected natural shocks or a pandemic, without a public health care, I don't think that even you put money, if you put any one, without a public health care, the health workforce, which is the leadership here, it is very difficult for us to. That is the most critical aspect among those. You ask for one question, one answer, I will say this answer, that public health care is a critical thing. Why? Because it's a very technical thing. You do, even you took at dengue is another example I can say. And even if you look at maternal and child health. So public health care is the biggest fundamental building block of health system strengthening.
Absolutely. Agreed, Darius. I mean, that's a very valid point that when we are living in a country like India, which has a diversified population and most of our people coming from the rural part of our country, the role of public healthcare and looking at the levels of prevention, I think that's a very valid point that you have highlighted. Thank you very much for bringing that. Now, this brings me to another question, which is like, on one side, we spoke about what are the current learnings that we can take from the COVID disruption that we all faced and currently facing. And on the other side, we all spoke about what should be the future health systems looking like. I mean, what should we do to strengthen them? Now, the question is to marry these. I mean, I know that Jayesh pointed about the importance of technology and how to reach the rural India by enabling technology-based systems. And Bhaskar pointed about the importance of infrastructure at the ground level. I mean, improving our capacity, improving the whole systems from an infrastructure perspective. And Darius spoke about what we need to do in order to get into the preventive mode. I mean, looking at the accuracy aspect, the cost aspect, and also looking at the public healthcare as a vital component of the entire system. Now, the last question I have for the panel is to how to create this ecosystem. I know that everybody has a role to play, right? So governments have a role to play, private sector has a role to play, then we have education systems. So everybody have a role, and general public has a role to play. So what are your views about creating this innovation ecosystem? How to marry all these loose connects together so that we all are ready for the future in a more reliable and robust way? So let me pass on this question to Bhaskar to respond on what are your views to create this innovation ecosystem for the future?
Yeah, thank you. Before I answer this, how do we create innovation ecosystems? I think the primordial question would be that we should start investing more in healthcare. Across, I think, all states in this country, the country as a whole, what we invest as part of our GDP in healthcare is quite low. That has to really go up, first thing. Second, investment in HR in healthcare also needs to go up. For the size of the population we have, the number of medical professionals we have is also abysmally low. These two things have to be really taken care of, and no technology is going to ensure that these two shortcomings are taken away and we have a better system. Invest in your physical infrastructure. Without having an hospital, whatever kind of technology we have, however sophisticated the technology is, I don't think we are going to go there. So invest in physical infrastructure, invest in your human resources, then comes your technology. So technology will only go a little way, particularly in healthcare. Maybe technology works in a very geometric way in many other departments and other venues, but healthcare, it will only help you to go a little extent, not the whole way. So we need to invest in that. Then comes the innovation. Definitely a lot of innovations have been happening in the healthcare system. In fact, from lab to hospital, the amount of time it used to take earlier is now very low. And during COVID, we found that a lot of new technologies, which actually were, just 1 or 2 years old in the lab, were brought into the actual working during the COVID. That has been a good learning, that we need to ensure that the time between the R&D and the time between actual utilization has to definitely improve. That is one thing. And definitely there is a lot of role for innovation. What I would say in the state of Andhra Pradesh, in what I have said, that we are investing a lot in healthcare, in the sense that this year itself, we are spending around 11,000 crores on physical infrastructure in health. So building 16 new medical colleges. From independence till date, Andhra Pradesh has 11 medical colleges. This year itself, we are planning another 16 medical colleges. That is going to take us to 27 medical colleges. Not only it is going to improve our HR, it means more students, more output, and then apart from the medical colleges, the teaching hospitals will be there, which will improve the basic clinical side of the system also. And that would be one thing. And as innovations, we are open, and then a lot of things have happened during the COVID. As I've said, we were the one state which entire COVID management was digital. For the citizens, for our own staff, to us, and as administrators also, it was all totally done on a digital platform, so that we were not looking around, trying to get data, talking to people, asking them to tell us how many people were admitted, how many were tested, how many are positive. Nothing of that sort was done. It made our life easier and made life easier for people also.
Great. Yeah. Thank you, Bhaskar. I mean, that's really interesting. I mean, when you mentioned about the numbers of growth in our medical colleges, I mean, that is very interesting. That means we are getting ready towards a more advanced future where technology has its role to play, but at the same time, we have to get our fundamentals cleared up from building that infrastructure to embrace the technology which we're talking about. So thank you very much, Bhaskar, for bringing that aspect. So let me move on to a few questions from our listeners. We have some interesting questions from our listeners. So let me first read out the question, and then I'll open it for the panel members to pick that up and respond. So the first question is about the infection transmission from the hospital settings. So now there is a talk that I'm not sure whether it is valid or not, but we hear people speaking about, so there is infection all around. We go to hospitals and the infection, there is a high possibility that going to the hospitals increase the transmission of the infection. So how to reduce the infection transmission? By preparing our hospital settings, the first line of defense against any unknown disease which reaches hospital first for treatment, should it need to be contained in time or not? If so, how should we do that? And that's the question from our listener. Darius, do you want to pick this up? Being a doctor and a bureaucrat, I think your answer will be more appropriate for this. Yeah.
See, hospital-acquired infections or nosocomial infection, not exactly even the, like, for it has been always been a problem medical, like health sector has been facing. And there are fixed protocols, not for like, not the pandemic setting, even in general setting. For example, if you do a surgery, you have MRSA, methicillin-resistant Staphylococcus aureus. That is one of the toughest organisms, like for example, in hospital setting. And we don't have enough antibiotics to deal with that. So my point is that this has been a problem which hospitals have been facing at different levels. One is the general infection, which happens anywhere in from, like, for example, what happens in the waiting area or what you do it in, even in the public, then what happens in the hospital procedures. How do you get from, that is called nosocomial, more like infections. So this, there has been protocols. There are protocols being, like, for example, the first principle of medical science is do no harm. That is Hippocrates holds, like that has been the fundamental principles of healthcare system. So do no harm. Whatever you do no harm. So if you do good deeds and another, so hospital-acquired infection works against that part of the Hippocrates oath or the medical profession's basic fundamental principles. So there has been different protocols in place, different types of workplace, occupational health related aspects, which has been put in. I'm not saying that it has been a very systematic or high level. For example, even if you look at the COVID situation, it's a PPE kits, the kind of PPE we have, what the kind of facilities we use. So there has been different levels. The hospitals have been trying, hospitals or any health facility has been trying to tackle this problem. And this has thrown one more challenge. For example, TB, if you look at any district TB center, the plan, the way it's planned, it's very clear how the air supply is happening, how the district, that RNTCP has been dealing with this issue in every district TB center. If you see that their plan, everything has been worked into. State STO will work all these things in. Hospitals have always been trying to do this. I'm not saying that it's all been successful, but it's a question which we keep on trying to integrate, not that we do take different types of audits. And this is one of the biggest audits we do in every health system. Like what is a nosocomial infection? What are this? Because there are specific bacteria which comes only from hospital-acquired infections. I told you MRSA. There are other things also.
Sure. Thank you, Darius. So we have the next question coming from Shrikant Lal. So the first question came from Anjali Agarwal. Thank you very much, Anjali, for the question. The second question is about Make in India ventilators, which Shrikant Lal has put forward here. And I will route this question to Jayesh Ranjan to respond. So the question is, we hear a lot about Make in India ventilators made into the market, which are possibly not regulated. So does this set of ventilators development, homegrown medical devices that we're talking about, potentially creating a loophole in the healthcare infrastructure because they are not regulated? This is one part of the question. The second part of the question is that how about the other players and how are they responding to this Make in India ventilators? Jayesh, your views on this, please.
Yes. So when I spoke about the achievements of young entrepreneurs in Hyderabad in developing and prototyping a very low-cost ventilator, I also mentioned that it did not dilute any of the functionality. And it received certification as well. I mean, whatever testing certifications were required, all those were obtained. And before it was rolled out, it was tested in the premier government hospital in Hyderabad called NIMS. So I'm not advocating at all that in the name of Make in India, you dilute standards, you dilute certification, quality, etc. Should never happen. So, but it is still possible to encourage homegrown talent to come up and prototype and come out with good solutions without diluting any of the requirements, as the example of the ventilators has been shown. And once the ventilator was tested and confirmed that it meets all the standards, actually commercial company joined hands and started manufacturing it at mass scale. So it is also possible to find good players in the market who can, scale it up. The entrepreneur can only prototype and design and show it on how it works. But if you have to really mass produce, you need to piggyback on someone who is already in this business. So the second part of the question, which is about how do other players take a look at it. So this is very, very common. I mean, there are so many sectors in the economy today which have been disrupted by startup activities. And if you are very agile, then you also change your business model and you try to battle it out and so on and so forth. So this is no different. Of course, the numbers are very small. The numbers which this Hyderabad-based group of entrepreneurs have produced are just a few hundred. So it has not caused anything more than a ripple in the overall ventilators market. But they have shown the path that it is possible to bring down the cost by 1/10. I mean, by 9/10 rather, and make that device available at 1/10 the cost. So obviously, once the once this normalcy returns, and when people start looking at these medical devices in a normal way, there will be lots of disruption in that market, and the established players will either pivot or they will have to perish, as is true in so many other cases.
Right. Thank you, Jayesh.
One point.
Thank you very much. Yeah, go ahead, Naresh.
See, basically, when the question we have to look at the strategic interest of the country also. Like if you look at the active pharmaceutical ingredients, like which we used to export a lot from, now we have been dependent on China for that. Now, if you look at the PLI scheme of government, the pharmaceutical department, like now we have been given performance like incentive for our API bulk drug manufacturers to be strengthened so that we are not unduly dependent on, because when I was working at MNH, we understood how the amoxicillin syrup supply was disrupted when Chinese API shifted from the eastern seaboard to the Tibet based on some environmental clearance. So strategically, this is a very important push we need to do so that we are not unduly dependent on our antibiotic and other systems on any other players. We should have our own inherent strength.
Okay, that's great. Thank you very much, Naresh, for adding on to Jayesh's response. Thank you very much. So I think we have got amazing set of questions in front of us. I'm able to see several questions flowing in the Q&A box, but in the interest of time, we may not be able to pick up all the questions. But if I have to summarize the overall 1 hour of our learnings from this session and the takeaways, I would put it in 3 important takeaways that we all can take from this session. Firstly, the importance of building an ecosystem, where our panelists spoke that there is a role for technology to play, there is a role for our basic infrastructure to be strengthened, there is a role for the private and public players to collaborate and come up with more operationally reliable systems. So when we look at the overall innovation ecosystem together, it has an important role to play for the future. The second takeaway, which I personally like from the entire discussion, is building in a framework. I mean, representing ISB, I would love to put that into a framework where we have the basic infrastructure which hits the bottom of the pyramid first, the most essential aspect of any country to build on. And then comes the understanding of the systems in order to kill it at a proactive level, where Naresh spoke about looking at the investments that go into the public healthcare systems. And then the top comes the innovation ecosystem, which we spoke right in the beginning. So the 3 aspects which have created a pyramid, which is very interesting for the viewers to kind of take away from this session, is another important aspect to highlight. And thirdly, from the questions which came up on our chat window and the responses that we have gathered, it is also interesting to note that there is no one way to solve the problem. I mean, there are different ways, and people and different governments are trying to respond to the current situation in different strategies. Now, looking at one strategy or one solution for the future is not a right way to think. And I think the panelists have echoed it pretty well, where we have to look at from an ecosystem perspective, and that even reflected in the questions, the response to the questions which our listeners have put forward. So thank you very much, all the three panelists, for being with us. I know it is a very busy schedule for you, but you have taken your time to be with us and respond to all my questions and also to the listeners' questions very patiently. So thank you very much. This is Vijay Sundar signing off, and back to Raj for the rest of the formalities.
Thank you so much, Vijay. I would like to thank the three panelists that we've had, JSG, Bhaskar Garu, and Dr. Darej. And I hope this fruitful discussion will lead to many good things happening with our healthcare system. I hope we can take lessons from here and use them in our day-to-day work to improve the continuing response to the pandemic in the short term and to improve the Indian healthcare itself in the long term. Thank you so much, Professor Vijay Sundar, for moderating this session. I will now ask my colleague Rakesh Ranjan to take over as the host for the next session on healthcare business model, innovation for the new normal. Thank you so much for joining us.